Looking for a path forward in the fentanyl crisis. So thanks for joining us on KOIN 6 News at 5. I'm Jenny Hansen in for Elizabeth Den.
And I'm Todd Unger in for Jeff tonight. Today, KOIN 6, the only local station they're listening in as dozens of service providers, government leaders, health experts, and others came together to talk about the next steps. And Brandon Thompson was there as well. And Brandon, money is one of the key issues here.
Yeah, money always one of the key issues, as well as communication and coordination, some of the key topics I heard today. And all three of those play into each other, like getting law enforcement and outreach groups to coordinate missions together, and even allowing service organizations to work together even when they're on different government contracts. Day 43 of the fentanyl emergency, bringing 130 healthcare, government, first responder, and service organizations together.
We're only as good as the work the other people are doing if we know about it, right?
John Carp Evans has been in on nearly every unified command meeting of the emergency so far. With a background in outreach, he says today helped he and other service providers realize the barriers to them working together.
We're all kind of out there doing our own work, helping people, doing amazing things, but not collectively working across organizations or across government entities to give a person the best service.
He believes the contracts government signed should allow that flexibility to improve coordination. Providers marked maps for where they help people to find what communities need more support.
Understand what services are being offered where, and where are those gaps, where are the places that are not getting filled with those particular services.
The fentanyl emergency has helped coordinate outreach workers and law enforcement missions so far, but through just the meeting of the minds today, it brought connections. Portland Fire and Rescue's Stephanie Sullivan runs the Bureau's overdose response team chat. She hopes groups that she met today can help them long past the 90 days of the emergency.
One of our problems was we were having a hard time with housing afterwards. So after somebody has an overdose and we want to get them into supportive housing, we want to get them off the streets. So now through this, we've made some connections. We've got the task site that we can actually call someone and they will pick them up, drive them over to the task site.
Testing out new methods to get a handle on the crisis. So funding, again, a big issue talked about today. Take Portland Fire and Rescue's chat team, for example. The funding for that runs out in September, and Sullivan says having more consistent funding for that and other service providers could help programs and organizations plan for the future. Live in downtown Portland, Brandon Thompson, KOIN 6 News.